To everyone, and warm Niue greetings to you all that are joining us today. It's a true privilege to be here today, and before I dive into my presentation, I'd just like to express my sincere gratitude to those that have been played a vital part in this journey. So Colin, Professor Jude, and the team, and also Director Minerva. Jude and Minerva both know that research is not my thing. I mentioned to them that, it's not really my cup of tea. So thanks. Your push has come into a shove, and now I'm here in this space. It's a real pleasure to be able to present this paper. In particular, I want to acknowledge Professor Vili Nosa and our colleague Nafanu Pili, who have been instrumental in collaborating with me on this paper. I want to thank them in particular because as a dentist, and knowing oral health is not prominent in research or in work in the Pacific, I admire the dedication to advancing oral health research in Niue and the Pacific. So I really hope our collective efforts will help close the research gap in this area and bring greater focus to Niue's health needs. I also like to give my special thanks to my team as well. Without their support and perseverance, this paper would not have been possible. So yeah, next slide, please, Louis. So my interest in research came from when I did my master's in the University of Auckland with Jude and Professor Vili. It was an applied coursework, and I didn't want to do the research stream, but they both pushed me to translate that piece of work into a research paper. At that time, Professor Vili and I were discussing about data that was available in Niue and an opportunity to collaborate and get published. And then came the idea of using dental annual reports that we had in Niue as a starter for a publication. So the research project we had then, the main aim was to understand the current state of oral health in Niue and to see areas that we needed to improve on, especially on oral health outcomes. So the two objectives or the two key parts of this research project was the literature review. And this was to gain a general understanding of oral health issues across the Pacific. The second part, the main one, was the document analysis. And that was to examine the dental services in Niue and position them within the context of the broader Pacific Island countries from the annual reports. All these findings were synthesized to produce the written report, which was ultimately peer-reviewed and submitted for publication. Yeah, next slide. So the literature review involved a scan for articles that mainly sourced from the Google Scholar and Medline Ovid from Pacific Island countries and research evolving around dental work or oral health. That narrowed it down to 20 articles from 1969 to 2018. And if you can see, there's relatively little for oral health in terms of the articles available out there. Next slide. The common themes we picked up from the literature review was firstly, the prevalence of disease, which focused a lot on dental caries and periodontal disease. The second theme we picked up was existing interventions or efforts that help address or combat these issues. And finally, we identified the third theme as barriers to success and challenges and how we can use those to improve the situation. So overall, the first theme of the prevalence of diseases, the issue of dental caries and periodontal disease, they were both identified as the most significant oral health challenges in the Pacific region. Dental caries, as we all know, are as tooth decay cavities. They occur when bacteria produce acid and erode the protective tooth surfaces or structure. And this is often measured using the DMFT index, which looks at the decayed, missing, or number of field teeth a person or child has. So from the literature review, we picked up from the Cook-Collins paper that while only 12% of 5-year-olds in Rarotonga had experienced some sort of tooth decay, there was a higher number, approximately 100% amongst those that are 15-year-olds that had dental caries as well. So this shows how the rapid rise of dental caries as children ages. And dental caries, if not treated, can lead to plenty of difficulties. Chewing and can affect their nutrition and eating habits and far-reaching social consequences as well. The literature also points out to globalization as a major driver of increasing dental caries, particularly the shift from the traditional diets to westernized diets. Pacific Islanders now consume more energy-dense food and nutrition-poor foods, which is a major key factor in the rising rates of dental decay. For periodontal disease, there was less research that focused on periodontal gum disease in the Pacific, although they do pose a significant risk that includes tooth surface loss, tooth loss, cardiovascular disease, respiratory issues, and adverse pregnancy outcomes. So yeah, next slide. For the second theme of the literature review, we picked up a number of existing interventions across the Pacific, mainly in Tonga, Palau, and Niue. In Tonga, the Mali Mali program is a toothbrushing and fluoride rinse program they have in the primary schools and showed successful outcomes where they managed to reduce the DMFT score from, I think it was around 4 to 2. So it showed how successful their programs were. In Niue, we had also implemented the Atuhoma Mali program as part of the Niue Oral Health Strategic Plan that was introduced in 2015. And this focuses on integrating oral health education into universal health coverage and targets children at the preschool level or kindergartens before they started school. Because before that, we picked up that while our program was involving the schools only, there was a high number of caries amongst the 5-year-olds. So we shifted the focus in our programs to involve preschool children at the kindergarten, the creche, the ECE, and we also integrated our services with the maternal child health care here at the hospital and their families or their carers. Despite some of these challenges, there's some stigma around lunchbox choices or how parents prepare lunches or what they put in the kids' lunchbox. This was an important step for us in targeting that sort of dynamics, not directly children, but creating that rapport with the carers of the children, including facilitators of the kindergartens and early childhood centers. So there we established that children with decayed teeth, there were early warning systems for other NCDs later on in life. And that's what led us to target them at an early age. And we understand that there has been some link between oral health and NCDs. There is evidence out there that suggests this link. However, there was little integration in how we can manage them. So more evaluation is needed on these programs to establish that link more. Yeah, next slide. So the recommendations for improvement, according to the literature, focuses mainly on the surveillance and monitoring system. I think it was all across the Pacific region. Health information systems and monitoring and evaluation capabilities were chronically underdeveloped. The second issue was that of human resource. The professional development and training for oral health staff was limited and opportunities that were hardly any. The Healthy public policies or legislations within the different governments, they vary, and the lack of support towards policy that could encourage oral health seeking behavior or better outcomes. And also there was a recommendation for a more collaborative approach, which I will touch on again later. Yeah, next slide, please, Louis. So the main part of the research project was the document analysis. Now, this analysis revealed several challenges. It was a review of the dental reports from the dental clinic in Niue, and this follows the basic standard formatting of annual reports in Niue. Notably, there were no dental reports or annual reports at the Niue Hospital before 2011. So when I started working, we got into the system where we routinely reported on an annual basis the clinical output or operations we had at the clinics, and including the oral health findings we had from the school checks. So Professor Vili and I, including Nafanua, we decided that our scope was on 2011 to 2018, reporting on clinical data, the key challenges, achievements, and recommendations. So from the analysis in general, it was a mainly descriptive data, and it showed that dental caries in the clinic was the leading cause for tooth extractions, and particularly among primary school students, where 60% of students had untreated dental caries. It was important to note from the annual reports that there was a gender gap in dental visits, with men attending the clinic less often than women. So this underutilization by men remains a consistent issue over the 7 years. Next slide, please. Okay. So the table showed these sort of trends from our services, right from 2011 to 2018. And it showed that the program has improved a bit in terms of the DMFT scores of the primary school children. We managed a reduction of at least 1 from an average score of 4.4 to 3.5. The data showed that caries was more prevalent amongst primary school kids, whereas high school students experience low rate of dental caries, presumably because of our referral processes after school checks to the clinics for them to get treatment. Next slide, please. The challenges, according to the document analysis, were common amongst the whole health system in Niue. It highlights issues with our health information systems and the specific need for robust and data collection systems. For the oral health reporting, the MedTech software that we use as a health information system was not designed for dental practice. So we were both going on a manual and computer-based system, and it's a huge barrier to data collection and analysis for the team. Similarly, there was a lack of monitoring and evaluation capability for us to monitor trends and knowing. If you can refer to the previous slide, it only showed descriptive data. So we were hugely lacking in the qualitative side of things. Other issues include a lack of biomedical engineer to cater for the regular maintenance and upkeep of our equipment. The turnover time for sourcing this sort of help would take more than a year or two. So that shows sometimes how it can impact the flow of services at the dental clinic. There was a delay, there was an issue with delay in procurement processes, and that is across the board due to government procedures. While it can be a bit frustrating to understand at times, review of this can be enhanced to improve our service delivery. There were technical difficulties for data collection by the team due to the ability and capacity of the local staff to carry out the routine data collection. Oral examination is sort of a challenging exercise in the sense that it requires a lot of resources and time, including skill and proper calibration of the practitioner or the oral examiner. So yeah, recommendations. Next slide, please. We picked up the 4 recommendations based on the literature and aligned it with the document analysis. And what it showed, monitoring and surveillance systems can hugely be improved. It needs to have regular and detailed data collection, and this is crucial for assessing and managing oral health progress in Niue. Although some data exists, we do not have consistent reporting, which makes it very tricky to track the oral health trends. There's a huge need for training programs, especially tailored training programs to address the diverse needs of our patients. This should take into account the specific population or demographics and challenges that we face here in Niue. Okay, I think I should. For healthy public policies, I think the government should implement more public health policies that address the common risk factors for oral diseases and NCDs. One of the huge lessons we learned from this is our water-only policy that we have sort of engaged with the kindergartens and the creche to try and implement. So we're hoping that as a next line of work. And collaboration, lastly, there's an opportunity here for us at the hospital, which is already working for sectorial collaboration. The dental clinic in Niue is located within one hospital, and this positions us in a good opportunity for other disciplines to work together to address oral health issues with continuity of care, oral health through the life course of a patient, and care pathways. As we all know, the risk factors are the same as the major NCDs, such as poor nutrition, tobacco use, a high sugar intake. So it will make sense for us to come together and deliver an integrated care model. Okay. Yeah, next slide. I'll try and wrap things up pretty quick. So yes, one of my biggest takeaway from this research project is that local knowledge is very, very important in research. How it can shape outcomes and create meaningful change, especially in the fields such as healthcare and other public services. We often overlook the importance of lived experiences and contextual understanding of the locals. So this opportunity, research for Niue by Niue, highlights how local knowledge can, whether you're a health professional or public servant, a public service provider, a patient, or from the community, we all hold value in the research process. So this is also highlights how collaboration is really important, and I'm thankful for the University of Auckland through Sir Colin, Professor Jude for this opportunity. Fostering this collaboration with an established research institution, it brings in the expertise and the resources that us here in Niue lack, and therefore it enables us to be able to address the research gaps here in Niue. From personal experience, the mentorship from colleagues that enabled me to assist throughout the research process and open up opportunities to broader research, not overseas, but within the region. I was fortunate enough to be working on other papers, although not a really core research, but viewpoints. And it extended the impact of our work locally beyond the local setting. I think one of the papers I contributed to was printed in the Lancet, and that to me was a huge win professionally, but also for our health in the Pacific. Lastly, to ensure long-term sustainability in research anyway, I think it's imperative that we have to engage with the local staff. Our discussions around that I've been emphasizing a lot on that, in the sense that we are research aware, we just need to be more research active here in Niue. And of course, we also need the funding to be able to undertake this research I think it's important at different levels, whether you are an individual, an organization, but more importantly for Niue all across. If we can share and transfer our knowledge for Niue by Niue. And with that, yes, I end my presentation.
والله